Oh, he does.
What to do? Okay, I think we're all here, almost.
Somebody pawned that in?
Regent, yeah, okay, we need the president, and for Regent Shu, here comes Mike, here's Michael.
I was in it?
And we're coming to order. Regent Mayron, are you still on, and can you hear us?
I am on and I can hear you.
Okay, good, and you're also coming through loud and clear.
Thanks.
So I will call the March 2020 meeting of the Board of Regents to order. And right out of the gate, the first item on the agenda will not be the approval of the minutes. We're going to call an audible. I think you've all noticed that Professor Osterholm is on the agenda. He has some pressing time commitments, and so we're going to go straight to his report, and then I will come back to these other items. So. In the last several weeks, I've spoken with a number of business leaders in Minnesota, and really every single one of them is deep into the coronavirus topic and how to respond. The university, of course, is no different, and it's very appropriate for us as a board to be having a conversation about our preparedness and our response to a coronavirus pandemic. And so President Gable has established a leadership policy committee on this that you're aware of. She's managing the university's preparation and response to COVID-19. She's leading that committee as its chair. And as the governing board, it's really crucial that we also remain engaged with the community as it continues to be a public health threat. Earlier this week, President Gable testified on this topic at the legislature, and today, as you know, we are fortunate to be joined by Dr. Michael Osterholm, the Director for the Center for Infectious Disease Research and Policy. Dr. Osterholm is also a Regents Professor and the McKnight Presidential Endowed Chair in Public Health in our School of Public Health. You may have heard his name recently in the news. Also joining us is Jill DeBoer, Director of the Health Emergency Response Office and Deputy Director of the Center for Infectious Disease Research and Policy. And I should note that Dr. DeBoer will be joining us by phone. So I want to thank both of you for being here. We're grateful. We know you have been working very hard and tirelessly over the last couple of months, and we're looking forward to your comments in the presentation. And before you come to the podium, President Gable, would you like to provide some comments?
Thank you, Mr. Chairman, members of the board. I actually have a full update for you in some detail on what we've been doing on campus that I intended to provide before you heard from our subject matter experts, but I'll defer that to my report so that we can get Mike up and out.
All right, please.
Good morning.
Morning.
Thank you, Chairman Powell, members of the Board of Regents, and President Gable for the opportunity to be here today to share with you what is surely the greatest professional challenge that I have known in my 45 years of being at the University of Minnesota. You'll hear today about what we're doing at the university, which has been very proactive in this area. As you'll hear in a moment, we actually were involved with this situation in its earliest days in late December and had made an announcement to people who worked with us that, in fact, we knew that this would be a pandemic of the kinds of proportions we're seeing way back on January 20th. So this is not a surprise to us that we're seeing what we're seeing. In light, I think, President Gable, you were going to provide an update that I will just have you go ahead, and I'm going to ask Jill DeBoer, who's Director of our Health Emergency Response Office, give you a short update on what we're doing right now on campus to respond to this issue. And when I say on campus, as you know, our campus is the world. So in a sense, what we're doing in the world right now, which is really a substantial challenge. And then I'll be happy to add a few more comments and be sure to take any questions. And thank you so much for your willingness to change the agenda a little bit here. Unfortunately, we're kind of running a 24/7 shop right now, and we have some major issues coming up this afternoon. So with that, Jill is on the phone. Jill, if you'd like to address the group, we have your slides up, and we'll be happy to move them, and we'll just go right to the first slide for Jill. Thank you. Why don't we just pass through?
Chair Powell, members of the board, just to check that you can hear me okay?
We hear you fine, thank you.
Great, and I'll have us move to the next slide, please. It has been my pleasure to serve as Dr. Osterholm's Deputy Director at CIDRAP since 2002. At that time, we were asked to complete an assessment of our university's response readiness for situations like the one before us today. The Health Emergency Response Office, or HERO, is a result of that assessment. Created in 2004, HERO is co-located with CIDRAP, and we utilize a shared staffing model that creates synergy between both departments. As Mike mentioned, on January 2nd, CIDRAP news reporters published a story on unexplained cases of pneumonia in China. By January 22nd, the situation had evolved so rapidly, HERO activated a health operations team for novel coronavirus. The departments represented on that team are listed on your docket item summary. Members of that team have not stopped working since that day. I'd like to take this moment to formally thank them. If I can have you turn your attention to this first slide, our response plan was designed in 2 phases, which then became parallel tracks that now have merged into a comprehensive system-wide response structure under President Gable's leadership. And I understand she'll provide more information about that in her report. Next slide. As I mentioned, our early response efforts started on January 22nd with the following goals: to ensure safety of all of our international travelers, to implement CDC guidelines for healthcare professionals in our clinics and hospital, to partner with MDH on public health surveillance and traveler monitoring activities, to ensure that our campuses continue to support all students, staff, and faculty, to provide timely updates to our communities and timely response to questions and concerns using a centralized approach for information. And as I'll mention later, we've known we needed to prepare for a pandemic, and we have been doing that. Next slide. Let me briefly provide more information about each of our goals. As President Gable will outline for you, the university has made multiple adjustments to study abroad programs and travel policies based on the very, very rapidly changing federal advisories. We've pulled our students out. We have supported them as they return, which includes helping them understand the changing federal guidelines for their monitoring and their self-isolation or quarantine. We provide them with that information, make sure they understand it, and support them as they implement those guidelines. We also support our students should they be affected by public health investigations or actions in other countries. And importantly, we are looking at potential future needs of our international students should they no longer be able to return home as they had planned. Next slide. Healthcare providers are at the forefront of this public health crisis. We monitor CDC guidelines every day, and we coordinate information sharing with all of our U of M clinical operations. That includes our Cook Clinic in the community, our Boynton Health Service, our dental school clinics, and we also partner closely with M Health Fairview and UMP. We participate in 2 weekly calls each week with our regional healthcare systems and hospitals to stay up to date on local activities and coordination. Next slide. Partnering with the Minnesota Department of Health is essential for us. On February 5th, we requested and received a formal liaison between the University of Minnesota and the Minnesota Department of Health. We are in contact with that liaison multiple times each day. We continue to monitor, again, CDC guidelines that change daily. Our Boynton Health Service is serving as a sentinel surveillance site for the Minnesota Department of Health, testing individuals with travel history and symptoms. We also participate with all local health agencies and the MDH to understand the guidelines for patients under investigation, the guidelines for confirmed cases in Minnesota, the guidelines for contact tracing, isolation, and quarantine. Next slide, please. This is a difficult and stressful time for the entire community. We want to make sure that our campus remains a supportive environment for all students, staff, and faculty. Our mental health professionals on campus are carefully monitoring our campus climate across all system campuses in all areas. Should we need to expand services, we do have a Coalition for Disaster Behavioral Health Response that is ready to assist as needed. Next slide. We all have seen the daily barrage of information on the news, on social media, and so we know it's important to provide our community with timely updates. We have been providing system-wide and targeted emails on various topics throughout the last many weeks. Some of those have come from our campus public health officer, Dr. Jacob Tolar. President Gable has been sending routine messages, and other senior leaders have been sending messages on topics such as human resources and teaching. Next slide. As I mentioned, we want to provide centralized and timely responses to all questions. We've created a system for rapid information exchange. We exchange information via phone, email, through centralized email addresses, and if it's a senior leader who needs information for planning purposes, we've made a commitment to get back to them within 2 hours. Next slide, please. As Mike mentioned, we've known for quite some time that this would become a likely pandemic. This week, the World Health Organization did declare this a global pandemic. On February 1st, we decided we needed to pull out our pandemic plan and revise it. Our campus developed a comprehensive pandemic response plan in 2005. That plan was created for influenza, but it is easily adaptable for novel coronavirus. I do believe that Regents have access to that plan. We pulled that plan out on February 1st. We asked all of our senior leaders to update the plan and revise it for coronavirus. We also have companion plans for disease containment and isolation housing should that be needed. You can see on the slide, and if you've reviewed our plans, the pandemic plan that we have includes 9 areas: campus infrastructure, communications, teaching, housing and dining, education abroad, international students and scholars, health services, human resources, public health response, and athletics. Each 9 area has been assigned to a senior leader who has been working on this plan for several weeks. I will note we have used this plan previously for H1N1 in 2009 and 2010. At that time, our pandemic response lasted 16 months. Next slide, please. We have established a structure for system-wide coordination and communication that capitalizes on important local response capabilities, partners, and resources. You can see from this slide that all of our Twin Cities plans are shared system-wide. Other campus plans are shared with us as well. Most communication is from a system perspective with chancellors and their teams working with university relations on locally relevant communications. Our HERO staff and our members of the health operations team are available to provide technical assistance as needed to any leader across campus. And you can see that our campuses are all working with their local and county health departments to ensure integration with their regionally relevant response plans. At this time, I'll end my presentation, and I know Dr. Osterholm and I would be happy to take any questions you have.
All right. Should we move, Dr. Osterholm, right on to your comments, or?
I'd be happy to if you want to take questions first.
Well, are there any, before we move to the next set of comments, are there any questions on what you just heard from Deputy Director DeBoer? Okay, Dr. Osterholm.
Okay, well, thank you. First of all, I just want to thank the Board of Regents for the opportunity to be here, but more importantly, I don't mean that just physically with you, but the fact that we as an organization within the University of Minnesota exist. Right now, we've become one of the #1 sources of information internationally on this issue. Our website is now being accessed by over 800,000 people a day are using our website from around the world. Because we're not behind a paywall like the New York Times or the Wall Street Journal or the Washington Post. We are becoming a very important access point for information. Our group remains very involved on a national, international level of trying to move us forward. As I said this morning, I was on Morning Joe, and after listening to the conversation for over an hour, I was again struck by this, and it really hit me that, you know, all we're talking about right now and focusing on is dying by this virus, which I don't want to minimize. It's very important. But we've got to figure out how we're going to live with this virus. We're talking about the next 6 months, not the next 6 days, not the next 2 days. And so when people are making decisions, we have worked hard to understand how do we get through this through the duration. We expect that we will see around the country rolling epidemics of this in communities that may offset by months. Right now, I can tell you, I was just on the phone minutes ago with the group in Seattle. It is a war zone there right now in Seattle. In Minneapolis, St. Paul, it's not. But don't expect that because it hasn't happened yet, we will see these rolling kind of situations. So we're in this for the long haul, and I think that because of the support that we've had from the university and the close working relationship with the President's office, it's made for us to be able to stand up and speak out. We will be likely speaking out on issues that will be controversial. Let me give you a case in point. One right now, everyone around the country is running to close schools, K-12. And yet we have no data that closing them are going to make any difference right now in actual spread of the virus in the community like it might with influenza. We do have data there. Why is that important? Because if we close schools, we've already determined that the 35% of nurses in this country who have kids through K-12, that 18 to 20% will have to stay home and care for them. And if we lose 20% of our nurses right now on top of the loss we're going to hit, there'll be a lot of people dying. And we're not thinking that way. We're not thinking, you know, we're playing a lot of this decision making like I play checkers with my 10-year-old grandson as opposed to a chess master who should be playing 20 moves down the board. So we're prepared at our center to try to use science to the best we can, recognizing that public perception of what's going on is sometimes not based on the science, and we need to really merge those two together to get the most impact. A lot of the things that we're going to hear about over the upcoming days, we will do our best to try to minimize the impact that that has on society. My best hope for this situation is that, in fact, we may not be able to have a big impact on how many people get infected with this virus. The estimates now run between 20 to 60% of the population will over the course of the next 6 to 8 months. But if we can avoid certain people getting the virus, those are at high risk of having adverse outcomes, or we can, in fact, prevent some people from getting it and overall and not having to go to hospital, that'll be great, because we worry desperately about the hospitals. I wrote an op-ed piece in the Washington Post 4 weeks ago, and it's never been truer. I'm absolutely convinced that this country will base how we're doing on what our hospitals do. And, of course, the University Hospital will be one of those. And if we're overwhelmed and we don't have enough of the respiratory protection for healthcare workers, they'll get infected. And in China, we've had 4,600 healthcare workers infected, including many physicians and nurses who have died. And so that's going to be what we'll concentrate on, and that's one of the areas we're working on very hard right now, is to try to make sure that we have our healthcare workers as protected as possible. So I would just conclude by saying this is a very unusual time. This is not like anything we've had before. And I appreciate the university's ability as a large organization to adapt and to consider and to move forward with this. And in that regard, I would just close with one last thing. And again, I surely don't mean this in a glib way, but when asked last night in another show what I thought about the issue with quarantine, I will just tell you right now, there are two kinds of people in this country at the way things are going, those that are in quarantine and those that will be soon. That's a hard thing to think about, but this brings it home in a way. And people who are public people are going to be, in fact, as you're hearing every day right now, the number of elected officials, the number of key people who are in public settings, and we're going to need to talk about that. What do we do? I don't mean to challenge you, but I pose forward what happens when this group gets quarantined because one of you comes to a meeting not knowing you're infected, only to the next day to find out, and technically you'd all be quarantined. That's the kind of things we have to start working through because it's going to happen to a lot of us. And so I think the challenges are many, but I feel like we're poised to respond to them. So with that, Mr. Chairman, I'm happy to answer any questions.
Okay, well, thank you, Dr. Osterholm, for those remarks and very sobering remarks. Questions? Regent Simonson.
Thank you very much for that. A couple of questions. Coronaviruses are in livestock as well. I know they're different. Okay, I know that. We have diagnostic tests for those. We use PCR, we use metagenomic sequencing. Why is it taking so long to get a good test for the humans? That's one question. Second thing is we make vaccines. We either do it on a platform basis, like with a baculovirus, taking the gene, spike protein, for example, or we'll make them in cell culture. So why aren't we looking down those roads?
Thank you. Sheriff Powell.
Please, yeah.
Regent Sampson. Let me just say that, first of all, on the testing issue, this is one of our darkest moments of public health. I can't remember a time where we've failed to do what we should have done. And one day there'll have to be some accountability as to why the CDC was not able to do what it should have done. I'm confident that over the course of the next 10 to 14 days, we'll see that rectified, that we will have the private sector involved and a number of other medical centers who will be coming forward with testing that will allow us to do this. So we should have known and we didn't. When South Korea can test more people in one day than we've been able to test in 8 weeks, that should tell you something that there's a problem. So I agree with you 100%. We will find out a lot more about this situation in the United States when we can test. As far as vaccines, let me just say that I could make you a vaccine tomorrow. The challenge is showing that it works and that it's safe. The working part's hard because, in fact, while there are some animal coronavirus vaccines, they're actually quite different for the kind of disease and what we have happen. And there's still some debate about, can we, first of all, induce permanent immunity with a vaccine as this particular virus? Number two is what kind of vaccine you're going to need is going to be very important in terms of trying to provide that immunity, and not to get too far now, it involve both B cells and T cells and so forth. So we have a lot of work to do that way. The safety issue, I think, will be a key one. We know that with the SARS vaccine work that was done in 2003 and then unfortunately dropped, there was a condition associated with, found with that in animals called ADE, antibody-dependent enhancement. And this is a situation where if you have no antibody, you get the disease. If you have lots of antibody, you are likely protected. But if you're in the between level, when you get infected with that natural virus, it actually causes a very vigorous immune response that actually can be fatal. And ADE is a big concern. You may have heard about it 2 years ago when the dengue vaccine was withdrawn in Southeast Asia, the Philippines, where school kids were actually getting severe dengue having been vaccinated because of ADE. No organization I'm certain of, the FDA, the European EMA, the FDA equivalent of Europe, etc., will license this vaccine out with extensive safety data. So that that just, again, prolongs the time period it'll take to get an effective vaccine. Thank you.
Thank you. Regent Shoup.
Thank you, Chair Powell. Thank you, Dr. Osterholm, for making the trip up here. I thought you were going to join us from your studio in the basement of Morrill Hall. I was also expecting for you to suggest that we cancel our meeting, but that didn't happen. So, no, in all seriousness, I want to thank you for all of your efforts, not only advising the world, but also advising our university. And it gives me great comfort to know that you're on the case. I know that we're very lucky that this isn't actually worse for a greater part of the population. It is supposed to affect the elderly more, and I think I'm below the threshold, so I think I'm okay. But I will be going into isolation after this, so you won't see me for a while. I was also comforted by the fact that the dean of our medical school told us that we're going to be doing drive-through testing. And I don't know if you can comment on that. You're probably aware of that. And The other thing is what number did you say that we would be, or the percent of our population would be getting this?
Chair Powell, Regent Hsu, the best guesstimate we have right now is somewhere between 20 to 60%. On an annual flu year, you can expect 5 to 12% of people to become infected. And those I think are very fair numbers. If I had to give you my best professional judgment, this is a model from a group in Harvard that we work closely with. I think it's going to be higher than the mid-range, so it could be 40 or 50% of the population will be infected ultimately by the time that we see this thing work through.
Yes,
Follow-up?
Yes.
And then also, I forgot to ask, what do you think the infection rate is right now, even though we don't have the testing? Do you think it's like 10% or, some number?
Chairman Powell, Regent Hsu, it's hard to say. I think that we surely have lots of unrecognized infection at this point, meaning that there's transmission out there, but the cases aren't severe enough to pick it up as this. If I could just give you a very brief scenario. In mid-January, an individual came back from China through the Seattle SeaTac airport, went home to his home in Everett, Washington, a suburb north of the Seattle area. 2 days later, began to feel flu-like symptoms, hadn't really been anywhere, and at that point, suspecting that because he had been in Wuhan that he might have this, he actually called his doctor. To make a long story short, everything was handled appropriately well. He was isolated. They thought they had all of his contacts. It was only the first week of March when all of a sudden there was a large nursing home outbreak. Others started coming into the hospital with the increased number of severe illnesses, that they realized that, in fact, they too had COVID-19. And using genetic markers on the virus, we could show that this was clearly the virus that this individual had brought in. There had been almost a good 6.5 to 7 weeks of unrecognized transmission that finally, when it then did become available through testing to look, oh my, there was a lot of it that had already started. And it's like that fire in your house where you don't see it, it's inside the walls until it blows, and then all of a sudden there it is. And so this is one of the challenges we have in communities, is trying to catch it early, to understand it's about to explode. That'll help us plan our healthcare resources, also the kinds of measures we take, so that we can convince the public that, in fact, there's a problem. If we keep telling people we have a problem, but they don't see it right away, their time is coming in April, they're going to look at us and say, oh, you just scared us needlessly. On the other hand, if we can say now we have data, the smoke alarm picking up something, that's why we need this. So your question's right on the mark, and testing is important. And I just want to comment, I do credit our medical school and the group for doing the drive-by testing, but even still we're challenged by the number of tests we get here, which are coming from the CDC, which hopefully will be improved substantially, as I said, over the next 7 to 10 days.
Thank you.
Regent Kenyana.
Thank you, Mr. Chair, and thank you very much for your work and for the presentation. Still on that issue of testing, with the limited availability of test kits and test material, how are we prioritizing who gets that test? I imagine you can't just walk in and sign up for one at the moment.
Yes, Chair Powell, Regent Opinion. I might ask Jill DeBoer to speak to the university specifically, because I think that's the group that obviously is the greatest interest here. We have, national, regional issues, but Jill, do you want to comment on testing priority for the University of Minnesota?
Certainly, Chair Powell, Regent Kenyanya, we do have ability to test through the health department at Boynton. Like every other clinic and hospital, we have limited test kits. We're hoping that will expand soon, both in terms of additional CDC-based tests, but also private laboratories will start to roll out tests as well, test kits as well. At this time, with our limited resources, patients who come to Boynton are screened for travel history and symptoms. And so those are the people who are most likely to be infected and most likely to be, if infected, spreading to others. And so at this point, travel history plus Symptoms are what we are using for use of our limited tests. In addition, our clinicians upweight and have the ability to make some clinical discretion decisions. So, for example, if a patient comes in with unexplained pneumonia, which is one of the key issues that started the concern about this new novel coronavirus, they can use the test for those patients with or without travel history just to check to make sure that they are not infected. As more test kits become available, the criteria for testing clearly will extend beyond that group.
Thank you.
Thank you. Regent Beeson.
Thank you, Mr. Chair. Thank you, Dr. Osterholm, and for your work at the university and your service to mankind. So we have students, faculty, and the general populace moving around the country and the world every day. Advice on travel, is it so dependent on where you're going to, or how would you recommend air travel guidelines? Thank you.
Chairman Powell, Regent Beeson. Let me just say that there are several parts to this answer. Let me first cover international travel. At this point, the risk of being exposed to this virus surely is not the same everywhere in the world, but it's enough that such, no matter where you're at, whichever airport you're in or where you're going through, you're at some risk of being next to someone who doesn't even realize that they're infected and they're potentially infecting you, because we know that people likely can shed this virus easily a day or more before they get sick. And so from that perspective, I'd say, well, you know, whether you're in London or you're in New York or you're in LA right now or King County, Washington, it may not matter. But there are two other pieces that do. I think that if you're on an international status, do you want to be hospitalized somewhere else in the world if you need care? And that could be a challenge. The second thing is, we do not have a rational policy right now in this country for exclusion of people coming back into the country from other countries. I'd just be very frank with you. The data we have clearly shows that the efforts that we've put into place so far, airport screening, no-fly zones, et cetera, have had little impact on this virus emerging into this country, in which we predicted it would. And we anticipate at this point there may be additional closings of airlines and flights between certain countries of the world beyond which was just extended in the call or the announcement the night before last, where Europe now is involved, except for England, which ironically England has the second highest number of cases in Europe, and we didn't understand that. So I think what you don't want to do is go somewhere and can't get back. And I think that's a very real possibility right now with more countries. So I think international travel is one thing. Domestic travel at this point, I would just go back to the issue of, you know, more people you're around. If you're at high risk for having a serious outcome with this, I think any kind of travel like that puts you at real risk. For the rest of us, we are at risk of getting exposed there, but we're going to be at risk wherever we go. So I would say no, non-essential travel. We have a policy that has been enforced at the university right now that I think is very reasonable, that there's no travel unless some circumstances that the President's office can review. I think that's a very prudent approach, and I would say the same.
Thank you. Regent Anderson.
Again, Professor Osterholm, I just want to thank you for all the work you've done at the University of Minnesota now and in the past. You do a great job, and I've told you that personally, and I for one, really appreciate what you do. My question comes, what do we know about transmission?
Yes, Chairman Powell, Regent Anderson. This is an area, again, where, to say the least, it's a challenge. And what I mean by that is there's conventional wisdom and there's the science. Conventional wisdom will tell you, well, you got to be 3 to 6 feet from somebody to get their droplets, which is what makes us comfortable. If I'm more than 6 feet away from any of you today, I'm okay. Or maybe you're not okay if I'm next to you. But, and then that surfaces play a big role. And hand washing, therefore, is something, because we all can do hand washing. Unfortunately, I have to say that while those can play roles, I don't want to minimize them, I think that the very compelling transmission we've seen with this virus, and we've seen this with influenza, we know this to be true, that aerosols play a huge role. When I'm talking right now, I'm filling up this space right here with aerosols. It's just coming out of my mouth. You don't see them unless you're standing by the window in your home and the sunlight comes through and you see all that stuff floating. You think, oh, that's just dust, you know. Well, those are aerosols. They float. They float for a long time. And the data we have clearly shows right now that's why you need to have the kind of respiratory protection if you're a healthcare worker called an N95, the very tight face-fitting mask, because if you have a surgical mask on, it goes right around and through it. So I think that the dynamic nature of what we've seen, whether it be on the cruise ships, whether it be the number of countries involved, the kinds of outbreaks we've seen, that this aerosol plays a role. And that is the same as influenza. So I liken this to saying it is like influenza transmission. And the way we've often talked about influenza transmission is the only way you're going to stop that is if you're vaccinated, you'll still may be exposed but not get sick, or it's like trying to stop the wind. And so this is one of the challenges we have today is I don't want to come and tell you you can do this, this, and this and not be exposed. It's really about social distancing. It's about how do you stay far enough away so that you're not sharing the air of somebody else with them and they with you. And that's really a primary means of transmission.
Okay, just one more from me, actually. What's the data say about the fatality rate now? I mean, you hear lots of numbers.
Yes, Chairman Powell, this is truly an experiment unfolding right before our eyes. We know that there are certain underlying health conditions that can predispose you to having a very bad outcome with this. What we know now about this illness is that in the first day you're sick, and likely at least 2 days before potentially, it's primarily a sore throat, upper respiratory in your nose, etc. In a study published this past week from Germany, we found the virus in the throat of these people 1,000 times higher than the virus levels we ever saw with SARS. They're very hot. Then most people actually have a vigorous immune response, and within 5 to 6 days, it pretty much goes away. For some who have these underlying health conditions, the virus actually makes its way to the lower lungs and then starts what can often be a 2 to 3 week journey before they get severely ill and die. And so when you look at China, the overall case fatality rate is somewhere between 3 and 4% according to the WHO. Others would say it's as low as 1.5 to 2%. But what drove that one was clearly older men who smoked. About 65% of Chinese men over 65 smoke. Ironically, only 2% of women. And the resultant differences were notable. And so that's when we don't have that same risk picture here in the United States, fortunately, because smoking has decreased. But we have other ones that are really a challenge. For example, 45% of our population today over age 45 are obese. Obesity has been a very closely related risk factor for also having a serious outcome. And that, by the way, is for both genders. We have 690,000 Americans right now living with end-stage renal disease. Fortunately, our modern medicine has kept them alive, but the bottom line is we have a lot of people in end-stage renal disease has been a big risk factor for having a bad outcome. Congestive heart disease, diabetes. So each country is going to be a reflection of the number of people by age that have these underlying health conditions that will ultimately determine the case mortality rate. So in this country, I couldn't tell you, it could easily be substantially higher than what we see in China. And it's more because of the population that will be getting infected as opposed to something about the virus.
All right. Well, once again, we're so grateful to you for your service, for what you're doing here in this particular instance, and thank you so much for taking the time out to give us this report today. We really appreciate it. Thank you.
Thank you very much. I just want to say I'm really proud to be a part of the University of Minnesota, and I appreciate President Gable's leadership on this issue and our ability to work there. CIDRAP couldn't exist in a lot of other places, and it does because of this university. Incredibly grateful. Thank you.
Thank goodness. All righty. Thank you. All right. And also, Deputy Director DeBoer, if you're still on, we're very grateful to you. Thank you for joining us via the phone, and we really so appreciate your service. Thank you. All right.
Thank you very much.
Yep. So now we'll move right along. The first item, second item now on the agenda is approval of the February minutes. Is there a motion to approve?
So moved.
Second? Any discussion? Moved and seconded. All those in favor of approving the February minutes, please say aye. Aye. Any opposed?
Aye.
Okay, thank you. All right, those are approved. And now we will return to the report of the President. President Gable, please proceed.
Thank you, Mr. Chair. Vice Chair Swigum, I will add my appreciation to what Mike Osterholm just said about working at this university, and in particular, our appreciation for being here in Duluth, Chancellor Black and his leadership team, and the student leaders and faculty and staff who've hosted us, particularly during this unprecedentedly confusing time. We are delighted to be here and very grateful for the opportunity to do so and to hear what you've had going on. So there is a lot that has happened in the last month, not the least of which is what we just spent the last bit of time discussing, and I will come back to that in terms of our operational response and flesh out some of the things that in particular Jill DeBoer described to you that we're doing in terms of readiness and mitigation. But I do want to make sure you're aware of the other activities that have been going on, and I'll do them briefly since the last time we were together. So, of course, we kicked off the legislative session. I testified, as many of you joined me, with our appreciation on our 2020 capital plan to House and Senate Higher Ed committees, House Capital Investment Committee, and had one-on-one meetings with Senate Majority, House Speaker of the House, House Higher Ed Chair, Capital Investment Ranking Member, and members of the Capitol Press Corps to discuss our legislative priorities. And I think some of you saw that coverage. So far, those meetings have gone very well. We have not received questions from any of our elected officials that created doubt in why we were asking for what we were asking for or why we were prioritizing what we were prioritizing, but just instead whether there was enough to go around in order to support the amounts that we were requesting. So we remain optimistic as the legislative session goes through, assuming things continue as close to normal as one can anticipate given everything that's going on right now. We've also been engaged in our university community, business and alumni partners and supporters. I met with the UMF Board of Trustees to assist them with their strategic planning, which they're doing in very close partnership with us, and updated them on our strategic planning so that we remain synergistic. I gave the keynote at the joint meeting of the St. Paul and Minneapolis Rotary Clubs, which now out of over 35,000 Rotary Clubs represent two of the most historic. Minneapolis is number 9, St. Paul's number 10, and they both honored me with honorary membership, which was greatly appreciated. We hosted our friend and the new Big Ten Commissioner, Kevin Warren, and his senior team to campus for meetings. This is part of his inaugural tour of all of the campuses, and we were very glad to see him. I traveled to Palm Springs and Phoenix to meet with donors and alums, and to Iceland to deepen our work with our nearly 40-year partnership with Haskell Iceland, which is the oldest university and English University of Iceland. And we had an alumni event there with over 60 people in attendance, which was amazing. All total, we saw hundreds of people in the last few days who love and support the University of Minnesota, and that was great. On March 30th, we will welcome Dr. Rachel Croson as our next Executive Vice President and Provost. We've been working together hand in hand on her onboarding and getting her ready and involving her in the decisions that will take effect after her arrival, and that has been going extremely well. And we kicked off our search for a new Vice President for Student Affairs and Dean of Students. Search committee kicked off in February. I delivered the formal charge and shared my expectations. Assuming things go according to schedule, priority deadline for nominations is the end of this month, and we would hope to bring finalists to campus before the spring semester, assuming we are able to lift our travel ban. My thanks to Vice President for Equity and Diversity, Michael Goh, and College of Education and Human Development Dean Jean Quam, and all the members of the search committee for their work in this very important addition to our leadership team. Last month, the board's Mission Fulfillment Committee heard a presentation on the Student Mental Health Initiative and next steps. As part of that work, we're working side by side with Minnesota State and Chancellor Devinder Malhotra as we consider this a shared challenge that we hope to work together to turn into an opportunity to serve incoming college students and all the students on our campus in the best possible way. We were going to convene a mental health summit on May 14th, which we've already decided not to do, even if things improve by then, and instead do what Bree Keeney in my office calls a pre-conference. I don't know if we made that word up or not, but we all sort of get the idea. We will do a webinar with the subject matter expert who we had engaged in order to create a virtual start to this shared conversation that we hope we can pick back up again in person in the fall. And I'll bring you more details on that as the planning continues. With regard to the board charge on institutional history, as part of the administration's work to fulfill the board charge from April 2019, to develop ongoing commemoration and educational activities that reflect our complex institutional history. The Office of the President co-sponsored with virtually every other office on campus a Twin City screening of a TPT documentary, which we premiered on February 18th at Northrop Auditorium, entitled This Free North, which highlights the African American history of the University of Minnesota in particular. We also had the board's governance and policy committee discussion last month, which we are now circulating throughout campus consultatively, and we'll bring feedback on that to you, and look forward to additional discussion there with the hope that we would bring an updated draft for your consideration at the June meeting. With regard to system strategic planning, at the board retreat on Wednesday, you heard a robustly updated presentation that included feedback from relevant constituencies and a pretty wide swath of partners concerning next steps for our strategic plan. We will take what we presented to you and what we then discussed during the retreat back out into the university community so that we can update you with further action at our next meeting. And then, of course, we have been consumed in every sense of that word by COVID-19, initially preparations and contingency planning, which have in real time, while we've been sitting together these few days, turned into a very robust set of action. So I'll start where Jill and Mike left off, reiterating their priority for the health and safety of our community, both on our campuses across our system, but also with the fact that we sit in the middle of a variety of communities where we are the concentration of human beings and want to be cognizant of what that means across the state and our role in that process. The preparation began, as you heard, in January with the empanelment of our Health Emergency Response Office, which is led by Jill DeBoer, who spoke to you by phone. We also refer to that as HERO. And they are charged with preparing plans and responding to emerging health emergencies, which she described to you in detail. They have practiced for this, they follow policy with this, and they've also done this in the closest thing that we've experienced up to this point with H1N1, although we all know how fundamentally unprecedented what we're dealing with now is. We also have CIDRAP, which is directed by Dr. Mike Osterholm, who you heard from, which is a research center on infectious disease, arguably the leading research center, and as a result of that, Mike is in great demand nationally, but we are very lucky to have the benefit of his wisdom right here on campus, guiding what we do and serving the state of Minnesota at world-class levels. We also have, and you may have seen the Star Tribune coverage this morning apropos to Regent Simonson's question earlier, 3 drugs in testing phases that our scholars are working on. None are a vaccine, but one is a immediate post-exposure prophylactic drug. One is for people who are in low symptom effects, and one is for hospitalized patients in high symptom effects. Those are all in expedited review, and those are hopefully will be positive contributors to our effort to contain what we have going on. And then, as you heard from Jill, we have escalated HERO into the Leadership Executive Management Committee, which I chair, in order to manage our own campus, our own system campuses, and make decisions as one unit about how to proceed. So we began, as you know, by canceling travel and pulling students, faculty, and staff back from what is called the level 3 countries as designated by the Center for Disease Control. When we began, that was China, Italy, South Korea, and Iran, although at the time we didn't have anybody in Iran. We had people in all 3 other countries, and we brought them home. Very shortly thereafter, as cases began to escalate, we went ahead and canceled in-person instruction, including field experiences and clinicals across all 5 campuses, and moved to what we call alternative instruction. Largely, that would be online distributed learning, ramped up behind the scenes, our IT capacity, pulled together national best practices and resources for faculty who don't regularly teach online, and in particular worked with faculty whose course content or field experiences / clinicals aren't typically delivered online to get them the resources that they need to ensure the quality of the student experience. That instruction will commence 2 days after the end of spring break on the Twin Cities and Duluth campuses, and after spring break on the Rochester and Crookston campuses. Their spring break starts next week. The idea behind that was that it takes a minute to gear up for this kind of thing. We made that decision somewhat on the early side, although many universities had made that decision before we did. I'll note that since we made that decision, everyone in the Big Ten has gone to this, and most of the other universities have gone to some version of this. But we did that because we wanted faculty to have time so that they could put up content in a way that was of quality, and that there was, as much as the circumstances allowed, no loss in the learning experience for our students and what we commit to deliver. And also, students need to be able to make travel plans. They need to be able to alter their plans, and that can take some time too. And we knew that everything would be flooded to airlines and travel agencies. We wanted to create a margin for that. We have encouraged our students to stay home or to return home after spring break. And we've been working very actively behind the scenes with HR to encourage people who can work remotely to work remotely for exactly the reasons that you heard described by our subject matter expert. One of the safest things we can do is stay away from each other in terms of transmission. And so we're trying to keep the wheels turning while creating environments like that. But for some of our students, their safest place is on campus, and so we remain open with normal operations modified. Those modifications include what I just described, but also wipe downs of frequent touch points, hand sanitizers, instructions in the bathrooms on how to wash our hands, although I know we all know how to wash our hands. And it's sort of like when the flight attendant tells you to buckle your seatbelt, but I guess you can't hear it often enough. And I will mention that I know this is a dangerous thing for me to say in Duluth, but the first verse of the Rouser is 20 seconds long. So if anybody's sick of singing happy birthday, it's an option. We are preparing, however, for the likelihood that we will have to escalate to canceling large gatherings, and we await advice from the Department of Health on what that means. The NCAA, Big Ten, and every other athletic conference have already preemptively canceled their gatherings. There's no more competition. And as of this morning, the Big Ten canceled all organized team activity. We had that conference call this morning. And that announcement is out. As you heard from Dr. Osterholm, we also canceled all non-essential international and domestic travel by anyone for anything that could be considered university business. We do still allow travel between the campuses. We have been in close contact with, and that would include extension and going to extension offices and research stations. We'll do that until MDH tells us that our state makes that dangerous. These restrictions all go until April 30th. We will do week-to-week assessment of whether or not we want to extend them. While we were here on Wednesday night, we learned by watching TV of a travel ban for all European travel into the United States. As you know, it took a few hours for that to take shape and be clarified. Initially, we thought it was everyone. Now we know that it does not cover certain parts of Europe and U.S. citizens or permanent residents. But that announcement was made at about 8 o'clock local time. For our 500, give or take, students, faculty, and staff in Europe, we scrambled so that they would wake up to a message from us and not wake up into a panic, and communicated with them. And we've been working around the clock to make sure our students on spring break study trips can get home, to make alternate arrangements for students who are about to take spring break study trips from our other campuses. We're working on plans for housing. Some of our students who were there for the full semester and are coming home because of the uncertainty around the travel ban don't have student housing. They gave it up while they were over there. We need to make sure they have some place to go. We're trying to provide as much certainty as we can in what is obviously a rapidly changing and uncertain situation. We are ready to escalate to the cancellation of gatherings, and we are ready to close the campus if we have to. We're hoping it doesn't come to that. We're making evidence-based decisions with advice from our subject matter experts like Dr. Osterholm and Jill DeBoer, and from our partnership with the Department of Health and the Governor's Office and the CDC with regard to travel. But in the meantime, I encourage you to wash your hands, cough and sneeze into your elbow, stay 6 weeks away, 6 feet away. 6 weeks away might end up being what we do, 6 feet away. express appreciation to our custodial staff and our other essential staff who are working really hard during very challenging times, and pay attention to the guidance from the MDH and CDC. That's what we're doing. Tonight, I'll be on Almanac to discuss all this, and stay after Almanac for a special program they're doing on COVID-19. And I will add that we are actively staffing our mental health support, both in person and remotely, because we know this is very stressful for our campus community, faculty and staff and students, and we want to make sure that people are having what they need in this very difficult time. So it's been busy month since we saw you last, but I look forward to keeping you updated on everything that's been going on. You'll receive frequent communications, obviously, on everything, and between now and our May meeting on all of our initiatives. So stay well, and thank you for all that you do.
Okay. Thank you very much, President Gable, for that report. My report, which we'll turn to now, will be very brief, but really what I want to do is offer on behalf of the board heartfelt and deep thanks to Chancellor Black and your team for the last several days where you hosted the board. I was trying to think of what the highlight was, and there isn't a highlight. There's just an overwhelming impression of the professionalism and the dedication of your team and the great work that you do here. And I think you've really, not that it needed it, but just a reinforcement of what a vital, critical part of our system, University of Minnesota Duluth is. And so I think it was 2 days very well spent, very candid, very substantive conversations. We learned a lot. We know it's an enormous amount of work, not only for those conversations, but to host this meeting here. And so please thank your team, Lynn. We're very grateful. We really appreciate it. And also, just to note that the dinner last night with representatives, leaders of the medical school and the College of Pharmacy, we understand the really important role they play in healthcare in Minnesota, and it was great to see them. And I'll conclude my report by recognizing President Gable, your very good leadership on this coronavirus situation. You've said a number of times that you had a lot of practice on crisis management, maybe more than you wanted at University of South Carolina, and it shows. It shows, and I think we've been very well led. And this is a situation where I think the president really needs to be hands-on, and that concludes my report. So, moving on now, please note the receive and file items in the docket this month, and we'll now move on to the consent report. Is there a motion to approve the consent report?
Move to approve.
Second? Second, okay. Any discussion, questions, comments? Regent McMillan.
Just note my recusal.
Okay, thank you. Hearing none, all in favor of moving the consent report, please say aye. Aye.
Aye.
Any opposed?
Aye.
Any opposed? I caught that.
I'm making a lot of mistakes today. So.
Penalty box. All right, any nays? All right, the motion is approved. All right, we've just earlier had the report on the coronavirus, so I will move on to, we'll move on to the report of the student representatives to the board. I'd like to invite Austin Kraft and Brandon King, Chair and Vice Chair of the student representatives to the Board of Regents, respectively. And I want to thank both of you for making the trip to Duluth to deliver this report. We appreciate it. Thank you. And the floor is yours.
Thank you, Chair Powell, President Gable, and members of the board. I would like to start off by also expressing appreciation to the presenters of the COVID-19 briefing and to President Gable on a topic and response of vital importance to the university community, including the tens of thousands of students statewide who are navigating these uncertain times. Student representatives to the Board of Regents, like Brandon and myself, are given the opportunity and responsibility to present the student voice to the board. In fulfilling that duty, Brandon and I are here today to discuss the 2019-2020 report of the student representatives to the Board of Regents. We address 3 topics in this report, as you can see in the slides: fostering the academic success of students from underserved communities, advancing affordability, and supporting students in research and discovery. These topics run in tandem with central questions about the current and future role of the University of Minnesota in supporting the success of its students and, in turn, the state. Before we begin, I must recognize the rest of the team of student representatives, some of whom also made the trip out here and are seated behind me. They made this report possible, and they bring crucial student perspectives to board meetings throughout the year. From the Crookston campus, Alora Demuth; from this campus in Duluth, Spencer Bassarich; from the Rochester campus, Misk El-Zahidi and Elizabeth Patterson; and from the Twin Cities campus, Leah Batten, Anthony Kahane, and Rodrigo Tocho Garcia. With that, Brandon King, the Vice Chair of the Student Representatives, will proceed with an overview of the first topic in the report.
The first section of the report looks at the academic success of students holistically. It examines how the university can continue to grow and supporting students from underserved communities, and sensitizing research on trends in higher education while pre-existing definitions from higher education as well professional organizations. We are considering underserved communities to be groups for whom participation, inclusion, and success has not been typically or continuously realized. Our hope with this dynamic definition continue a conversation about which groups the university serves and how it can broaden its supports. With this overarching perspective established, this section talks about all the programs on each of the campuses and how they can effectively help students to feel like they are able to connect with their cultures and also succeed. And this will be reflected in metrics as in retention and also graduation rates. The first recommendation is that the board revisits and follows the example from 2018 resolution relating to diversity in undergrad education on the Twin Cities campus in order to set goals across the system for closing the gap in graduation rates and measurements of student satisfaction. Such goals should be made with proper consolidation with appropriate leaders on each campus, devising attainable and nevertheless growth-oriented and meaningful targets. The second recommendation that the campus coordinate inventories on the academic success resources and programs available to their students. The Multicultural Student Success Committee did so over the summer using student feedback to identify impactful programs on the Twin Cities campus. In the spirit of the university being good stewards with their resources, we believe that inventory incorporated in campus-wide surveys will advance the practice of creating new resources when appropriate, but also building on pre-existing works when we already have in the right places. Each campus inventory of the programs will also benefit on communication sent out to the campus communities, as students will be able to learn about programs that align with their backgrounds, identities, or needs to improve their academic success.
The second section of the report considers affordability, a topic of foremost concern for students and their families. While student representatives have brought student perspectives before the board in recent years related to tuition increases, this section instead considers a different dimension of affordability, namely how the university financially supports students in the context of increasing costs for a degree in higher education, just looking nationwide. We recommend that the university, particularly under the leadership of the Office of the Executive Vice President and Provost, further promote the usage of the scholarship tracking and reporting tool, also abbreviated with the acronym STAR, so that as much gift aid as possible can be comprehensively monitored and dispersed to the greatest positive effect for students and their families. As detailed in the report, the STAR system has shown incredibly promising results in the years since its implementation in 2012-2013. Second, we recommend that the implementation of a directional goal that embodies the university's commitment to advancing affordability for students and their families. Namely, that the university's progress card incorporates a sort of goal that would be increasing institutional gift aid at a rate at least parallel to any increases in cost of attendance. I would like to mention that institutional gift aid is already a progress card measure, and this directional goal would make even clearer the university's articulated commitment to affordability. Lastly, this year's report discusses students in relation to the university's mission of research and discovery. The university is an internationally renowned research powerhouse. This research topic aims to further develop the framework for supporting students across the system in engaging in research activities, engagement that benefits students themselves, the university, and the workforce. Research involvement has been shown to improve communication skills, retention, and probability of graduating in 6 years or less. After a non-exhaustive survey in this report of research opportunities on each campus, we present 3 ways in which the university can be a leader in supporting students in research and discovery. First, we built on several semesters of advocacy already in the works in campus student governments, as well as the Student Senate, in recognizing the need for codified protections for undergraduate research assistants who are not paid for their work. Universities such as Purdue and The Ohio State currently implement a contract for undergraduate students involved in research in which they and their advisors sign in order to clearly lay out the amount of work and the kind of work expected of the student in their research. With there being often positive pressures for students to be involved in research, such as cultivating the academic skills to prepare for graduate studies, students in the current state of affairs could be put in positions in which they are doing more work or a different kind of work than they were anticipating. And once a research engagement has begun, it can be difficult to have those sorts of conversations with your advisor about the quantity or nature of the workload. Thus, we recommend that there be such a contract implemented for undergraduate researchers, starting with those who receive academic credit or financial compensation for their work before broadening to volunteer researchers. Second, we address the current lack of a system to comprehensively track how much research is done at the university, particularly by students. In addition to the utility of such tracking for benchmarking purposes, we recognize the importance of understanding what research is being conducted with whom at the university. As mentioned in a Student Senate resolution on this topic, tracking student research activities would help to, for example, prevent a student from getting involved with a faculty member who may have faced or is facing harassment charges. Our proposed solution directly dovetails with our first recommendation. Implementation of a research contract would provide, without additional effort or cost, a database of research projects being conducted across the system. Third, we seek the university's further support in a practice emerging from our graduate school, creating statements of advising philosophy for faculty advisors of graduate students. By clearly laying out their expectations for their students regarding key topics like funding, post-degree plans, and amount of advisor involvement in research, these statements of advising philosophy increase transparency and healthy communication between the faculty advisors and their graduate students. The graduate school at the university is a leader in this area, and we recommend that the practice of creating statements of advising philosophy be further promoted at the collegiate level to deans and department heads. Today, we've only touched the surface of 3 nuanced and essential topics, and we look forward to continuing this conversation in the subsequent discussion period as well as in the coming months. Thank you for this opportunity for Brandon and me to present students' perspectives, and we welcome your questions and comments at this time.
Thank you very much, student representatives. Before we open it up to questions and comments, I just want to thank you. The report is it's very comprehensive, it's very thoughtful, and I mean it's evident that a lot of work went into it, and so we appreciate the work that you do here. So, questions or comments from any member of the board? Regent Davenport.
Thank you, Chair Powell, and I just want to thank you for your thoughtful work and say that I am impressed with our future going forward with students like you. So, thank you.
Any other questions or comments? Regent Hsu.
Thank you, Chair Powell. Thank you, presenters. I want to also commend you for delivering a good report. I support it, and I hope that we can find a way to integrate this into our strategic planning process. And I'd like to kind of also say that, every year, you guys work for a whole year on this, and you deliver some things to us. And there are some themes that kind of come through each year, but then there are a bunch of new ones, and we never have a chance to actually work on anything. And so I think that's something that I hope to see us do in the future. Thank you.
Regent Anderson and then Regent Swigum.
Gentlemen at the podium, I'd just like to, tell you that you had a longer report in our docket material, and I really appreciated going through that. One of the things, there was a graph, and I think it's interesting as we look at state appropriations and tuition and everything like that, to understand what has happened in the financing of higher education from 1989 until today about state appropriations and tuition. And a lot of that information, I somewhat want to apologize to you too. You guys are up here in Duluth, and there's been other issues that came to the board, COVID-19, real estate. I just want you to understand that I read this stuff. Our minds are somewhere a little bit away from you guys today, if you can appreciate that. I'm just being honest with you. And I want you to know that we value the information you gave us in the entire report also, okay? Okay, guys? Thank you.
Regent Swigum.
Mr. Chairman, real quickly, if I could, Mr. Kraft and catch it here real quick. Mr. King? Okay, I remember it too. But thank you again for your report. I see that it's really focused on, quote, actionable items, I think that you put in there, regarding to the transparency about debt and aid. Did you at all consider or think about or contemplate thinking about the controlling of costs that we might have as a university system? Because costs directly relate to the tuition we must charge and the debt that you have. You seem to focus in on the aid part and the debt part with report, but not about the part that might control the costs that would directly relate, again, to that tuition. Did you consider that at all?
Chair Powell, Regent Swigum, yes, and you are definitely getting at one of the sort of core components of affordability in general here. We have considered it and do think that it is absolutely deserving of substantive discussion in itself, and I think that the board saw that part of that in these administrative cost discussions that have been happening as well. The sort of impetus for this particular topic, advancing affordability, was in the spirit of discussion before the board about addressing affordability that came up in September in the Mission Fulfillment Committee meeting. And so the reason that this topic particularly looked at gift aid was within the full realm of the university being committed to an affordable education for its students. This is following up particularly on that aspect that's been articulated by the university in that respect. But to get to, again, to your point, I would say that we definitely recognize the need for that also to be addressed when it comes to cost measures. But in the event that we are seeing these increasing costs, if these costs are going to increase, students expect the university to also be, in turn, thinking and acting on ways to support them in these contexts. And also, Chair Powell, if I may just return very briefly to previous Regent's comments, to Regent Anderson and to Regent Hsu. I appreciate both of those comments, and I want to follow up directly with Regent Hsu. The context of system-wide strategic planning was a focal point as we were crafting this report and recognizing that several different aspects of the different topics fit in quite well when it comes to goal setting and action looking years down the road.
Very, very good. Regent Kenyana.
Thank you, Mr. Chair, Representative Kraft, Representative King. Thank you very much for the report. Much better than the one I presented 3 years ago, although that was a low bar.
Amen.
Steve, you weren't on the board then.
I can just imagine what it was.
Yeah, that's true. That's true. I just want to make one point and then ask a question. First, I really like the focus on cost of attendance and calling it out that way, because I think sometimes we talk about tuition where there's a lot of costs packed in either in housing or other fees that aren't reflected in tuition. So I always encourage us to look at cost of attendance rather than just tuition. I like that that was done in this report. On you talked about affordability and also talked about aid, gift aid and scholarships and whatnot. And that was actually a conversation we had yesterday. And there's a school of thought, if you'll call it that, that you can raise tuition for several reasons. One, to portray a higher value, and then proportionately raise gift aid and scholarship so then the cost of attendance isn't higher for those that need it. You'll theoretically attract more students just based on the perception, and then for those who can't afford it, maybe some of them will just pay the higher tuition. And I hope I'm not mischaracterizing that. What are your thoughts on that? And I don't know that I necessarily subscribe to that, but there's this thought that you can raise tuition without really affecting what students are paying. And I'd be interested in just hearing your thoughts.
Chair Powell, Regent Kenyanya. Right, with these different schools of thought in terms of how to support students and advance affordability, and actually to circle back to Regent Swigham's comments and question about looking at these different dimensions of affordability, looking at the overall cost, and if we're increasing costs, then also increasing gift aid. This topic is predicated on this nationwide context of increasing, like just this trend of increasing costs for a degree in higher education. And so I would even suggest that we take a step back and almost, this is within the context of if the costs that are facing students are going to increase, then students expect that the support that's there would also increase. So it's that sort of implicational relationship that's there, not necessarily that we should increase both, but that if costs are going to increase, aid in turn should also be a central consideration. So it's not staking, the topic's not staking a claim in terms of what school of thought, if it should be high tuition and high aid, but that if there is going to be increased cost, there should be increased aid. Does that get to your?
Yeah, Mr. Chair, may I? No, I wasn't saying that that's what you were portraying in your, I was curious because that is a conversation we have. How do you think, and from your experience in speaking with students, how would they respond to that? How would they respond to if an approach like that was taken, in that, the sticker price is higher, but the cost actually isn't to the ones who need it the most, if that makes sense.
Chair Powell.
Student Representative. Yeah.
Regent Kenyanya, thanks for the clarification. I would go back into the report topic to look at trends in terms of financial literacy that students are, and the research is showing that students, unsurprisingly benefit from, and their families benefit from understanding what then lies underneath the sticker price and what that will actually cost the student and their family. If such if such an approach were to be furthered at the university, then that's the sort of response, or at least part of the response, that students and their families would most likely appreciate.
All right, thank you. So I want to conclude with a question that I have for the student representatives, and it has to do with again with the financial well-being focus of the report. So, and my question is, do you, in your conversations with students, and I know it's, not complete and informal research, but you are talking to a lot of students, what do you hear about, access to or availability of part-time work, which I think can be an important, part of, any student's budget for those who, have the time, inclination, want to do that. Is access to part-time work, especially on campus, is that part of the mix? Is it part of what you hear from the students that you talk to, or is it really mostly focused on the the STAR aspects, and borrowing and gift aid, that sort of thing?
Chair Powell, from the people I've talked to, a lot of the students feel like they are having access to part-time work, but the part-time work they may be able to find may not be enough to where they feel like they are sustainable.
Right.
So then that gift aid is things that are
Sure.
able to help them feel comfortable with going to school. But also I do know that a lot of students that are getting into their senior or junior year are feeling like they are capable of holding a part-time job once in a while due to the fact of the workload that they're going to have to take on during that time.
Yes. Thank you.
Just to add on to that, from a Twin Cities perspective, there is tension around dichotomy of part-time work on campus and part-time work off of campus regarding the wages that are available for work in the city of Minneapolis versus on the Twin Cities campus. Outside of this group of 8 student representatives, that's been a topic of particular interest among city's students, where we are facing these increasing cost pressures, and because the university has made strides in, for example, the realm of financial literacy, and so students are also in real time during their studies here understanding the burdens that they could be facing down the road. So there are those increased pressures to, for example, take on a job, and when they're making these choices about on campus or off campus, there are certain restrictions, say for international students, where they can work, but particularly around wages and on campus, off campus.
Okay, well, that's very helpful feedback. I appreciate that. Thank you. Oh, okay, there's one more question, and then we got to wrap it up.
Thank you, Chair Powell. On that particular subject, I was just wondering if you happened to have the wages at your fingertips in terms of where we are and where the city of Minneapolis is currently and what the differential is.
Chair Powell, Regent Chu, I would like to address that right now, but I also would like to have full confidence in the numbers that I'm giving you, so I'd be happy to follow up with you directly after this.
Great, thank you.
What I can say, though, is that there is a difference in that the city's minimum wage is greater.
Okay, thank you very much. Thank you for your report. We appreciate it. All right, now we're going to move on to the amendment to the East Gateway Project Memorandum of Agreement, and this is for review and action today. We'll consider amendments to the East Gateway Memorandum, but before I seek a motion, I do want to thank President Schmidlkoffer and the University of Minnesota Foundation for the partnership that they've shown in this most recent process, their willingness to address these issues very quickly. And I also want to thank Kathy for making the trip up here today to meet with us. We really appreciate it. And with that, the floor is yours.
Well, good morning. I guess it's good afternoon. Good afternoon, Chair Powell, President Gable, members of the Board of Regents. I just also want to acknowledge your agenda included very pressing work and the important decisions you are making on behalf of the university community, especially as it relates to COVID-19. So thank you for your leadership in this most critical time. So with that, also thank you then for making time this morning or this afternoon now to address the few follow-up items from the last month's East Gateway project review and approval. We appreciate the quick work by and attention of the Office of General Counsel and the Foundation's legal counsel to make these clarifying amendments to the Memorandum of Agreement between the university and the Foundation that we discussed at our previous meeting. But before the amendment review, on behalf of the Foundation's trustees, I cannot express how grateful we are for this important partnership and our shared commitment to support the university and its world-class footprint. I would like to reiterate UMF's excitement and dedication to this project, and we look forward to bringing this vision forward to the marketplace in service to the university. And in fact, we are moving forward on the East Gateway project on multiple fronts. In conjunction with the board office, we are bringing forth the governance and selecting members of the East Gateway Project Committee. You also might remember that's the special committee. We've kicked off the search for the new executive director of UMFREA, and we have begun the city and community engagement work as well. So before you today are the clarifying amendments to the memorandum of agreement, which you approved at the February board meeting. The amendments are summarized in the docket item summary, and you can find them also on pages 2, 6, and 8 of the red line memorandum of agreement. In general, these amendments serve to clarify intent and improve the language of the MOA, and specifically, we added language that confirms no interested parties can serve on the East Gateway Project Committee. We added language to confirm that in the very, 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 very unlikely scenario that we would need to remove any of the members of the special committee, it would be done in consultation with the university. We added clarifying language that makes it clear that university parking is not part of the East Gateway planning unless the university approves it to be, and the university is not obligated to provide a parking solution. And then the last two revisions, I would characterize that they really clarify the intent and language associated with some technical definitions. So I look forward to your support on these amendments as reported and presented. And thank you all involved for such a quick yet thorough turnaround so we could finalize the memorandum of agreement. So I look forward to our continued engagement and review of this project. And of course, you haven't seen the last of me when it comes to the East Gateway project.
Okay, well, thank you for that review of the material. I'd entertain a motion to approve the amendment to the East Gateway Project Memorandum of Agreement. Is there a motion? So moved. Second. It's moved and second. Any questions or comments on the amendments? Regent Brocia.
Thank you, Mr. Chair. Just real quick, I appreciate the effort, and it was I think Regent Mayron did some very good work in identifying some things, and I consider it to be a great gesture of good faith, and so I support the amendments, reserving my reservations about the base document and all of that, but I do want to just simply say thank you for your work on this, and I appreciate the effort.
Regent Swiggum.
Mr. Chairman, just very quickly, I too would like to thank UMF, Kathy, and our council for the quick turnaround on these clarifying amendments. And I want to assure all board members, which I'm sure you're probably aware of, but all board members, that your thoughts and your ideas and your advice and your concerns were involved in the discussions, the negotiations, Mr. Chairman, that you and Dave and Rick and Mr. Peterson were involved in with UMF in December and January. I remember sitting there and thinking, that, first of all, Regent Simonson, we were looking at this as a economic development, as a way to maybe gain some additional resources, something that you've talked about often, and for UMF and then indirectly for the university. And even Regent Sue, one time when negotiations didn't go very well, and it didn't a couple of times, Kathy, we came back and we said maybe the university should be doing this. And Regent Sue, we looked at the possibility of doing the project ourselves. We came up with the fact that there was going to be too many people we'd have to hire, too many development people. It would just take our focus away from the mission, take the president's focus away from what she ought to be doing, from setting our strategy and the mission of the university. And all of you, Regent Mayron, how many times did we laugh when Regent Mayron said a no-brainer? Ken. I mean, that was.
I never laughed.
Oh, we laughed because we said it was done then. It was over when Regent Mayron said that. And to all of you, I think that we came to a really good agreement, a really good compromise. And I would hope as a body we'd be able to set you off in a very, very positive support and vote. Thank you, Kathy Foshida.
Thank you, Regent Swigum. Regent Hsu.
Thank you, Chair Powell. I would like to echo the sentiments. I think it's good that we were able to update this, and I commend Chair Powell for actually doing so. And I don't want anyone to confuse. I will support this because I think the changes are positive and they reflect conversation from the last meeting, but I do not support the project, and I still maintain that if this is part of the university's mission, then the university should be supporting it ourselves. So thank you, Steve, for what you said, but I just can't support this at this point. And I'll support the changes. Thank you.
Okay, seeing no other, none of you, no others who would like to speak. It's been moved and seconded to approve the amendment to the East Gateway Project Memorandum of Agreement. All those in favor, please say aye. Aye. Opposed?
Aye.
Any opposed? Okay, great, thank you. All right, so that carries. All right, we will now move on to the report of the committees. One committee met this month, if I remember correctly. But Regent McMillan, will you please share the report of the Finance and Operations Committee?
I will indeed, Chair Powell, and if any of us don't remember that meeting, we probably got some short-term memory challenges. But the Finance and Operations Committee acted on 7 items earlier today. The committee voted to recommend approval of the resolution related to the sale of KUMD to the Duluth Superior Area Educational Television Corporation. I move its approval.
Second. So moved and seconded. Any further discussion? Seeing none, all those in favor of the motion to approve the sale of KUMD, please say aye.
Aye.
Aye. Any opposed?
Aye.
Okay, there's one no. All right. Okay, thank you. That carries. Regent McMillan.
The committee voted to recommend approval of the sale of Murphy Warehouse, located at 701 24th Avenue Southeast, Minneapolis, on the Twin Cities campus, and I move approval of that real estate transaction.
Is there a second? Second. All right. Is there any further discussion? Regent Rocha.
Sure. Thank you, Mr. Chair. Request a roll call on this vote. I had taken 2 bites at the apple in the last discussion and hadn't had a chance to respond to a couple things, but I just want to, if not for this audience, which seems pretty well dug in for our society that survives the pandemic as a record, this is remarkable to me that we are calling property that we are using not needed, calling property that's closer than other property that we are maintaining and planning to use similarly as less convenient. And we are taking the unusual, in fact, I don't even know a circumstance where we have ever taken land that we use and own and sold it to a for-profit entity where we will go from having income greater than the cost of the debt service and gaining an equity to then going to pay for the space and not control the space anymore. I think it's going to limit opportunities for future boards, and I perish the thought that our approach to honoring gifts and donations from benefactors such as the Murphys, that our standard is now, once we get past the 3-year tax provision for that component of the gift, that's all of the longer that we're going to take into consideration the wishes of the person providing the donation to the university. It's a disappointing vote. The data is in front of you. It's in the information that I provided. The speculative expenses have not been itemized to us and include things that we are going to continue to pay despite the sale. So we will not get the gain that is suggested. We are going to be paying out, and we're going to lose control of an important piece of property, and it's disappointing for the future of the land planning for the university, and it's also I think disappointing for the family that had taken this step in hopes of being able to aid the university in that going forward. So I will be voting no.
Thank you, Regent Rocha. Regent McMillan.
Thank you, Chair Powell. Speaking now as a member of the board as opposed to this morning chairing the committee, I can respect and understand most of Regent Rocha's objections here, but one I do want to speak to right now, since he just raised it, is the connotations of donor intent in that. I think that we misconstrue this transaction when we get too deeply into donor intent. It was constructed as a sale and a leaseback transaction, and the document, in my mind, speaks for itself. I know there's a letter from the family, but I just want to be very clear that it is the transaction that the university executed. The foundation wasn't involved, and any receipts that were provided were purely tax-driven, and I think led to some tax benefits for the family, plus the opportunity to wind down a complex, closely held corporation, all of which was facilitated by that. So us exercising our right to exit that property more than a year after the minimum time we committed to hold it does not, to me, constitute a violation of donor intent. So that's all I have to say.
Thank you, Regent McMillan. Regent Hsu.
Thank you, Chair Powell. Kind of on that same issue, I think it was a little bit mischaracterized in our previous meeting, which was a few minutes ago. I don't think the Murphys ever intended or ever thought that we would sell this property. And I think that, conflating the tax issues and the amount of time we had to hold is not quite fair. But anyway, I remain opposed to this transaction, and I hope that we don't end up buying it back for $60 or $80 million in a few years, because we have a history of doing that. Thank you.
All right. There's a motion to approve the sale of Murphy Warehouse, 701 24th Avenue Southeast in Minneapolis. A roll call has been requested. We'll take the vote now. Mr. Steves, will you take the vote?
Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr is absent. Regent Hsu.
No.
Regent Hsu votes no. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
No.
Regent Rocha votes no. Regent Simonson.
No.
Regent Simonson votes no. Regent Swigum.
Yes.
Regent Swigum votes yes. Regent Powell.
Yes.
Regent Powell votes yes.
So the motion carries with 8 votes for and 3 against. So that motion is approved. All right, Regent McMillan, back to you.
The committee voted unanimously to recommend approval of the purchase of 414 Erie Street Southeast near the Twin Cities campus, and the committee moves approval of that real estate transaction.
Is there a second? Second. Any discussion? Hearing none, all in favor of the motion to approve the purchase of 414 Erie Street Southeast in Minneapolis, please say aye.
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 Any opposed?
Aye.
Opposed. All right, that motion carries. Back to you, Regent McMillan.
Thank you. The committee also voted unanimously to recommend approval of the purchase of 2829 University Avenue Southeast and an accompanying piece of property at 2721 4th Street Southeast, Minneapolis, again, adjacent to the Twin Cities campus. And on behalf of the committee, I move its approval.
Second. Chris, second. Thank you. Any discussion? Okay. Hearing none. All in favor, please say aye.
Aye.
Aye. Opposed?
Aye.
All right. Thank you. We heard you, Janie. Thank you. That one carries as well.
Moving to labor agreements, the committee voted unanimously to recommend approval of the resolution related to the proposed labor agreement with Law Enforcement Labor Services, Law Enforcement Unit Local 196. I move its approval.
Is there a second? Thank you. There's a second. Any discussion? The motion is to approve the collective bargaining agreement with Law Enforcement Labor Services, Unit Local 196. Hearing none, all in favor, please say aye. Aye. Any opposed?
Aye.
Right, that carries.
2 items left. The committee voted unanimously to recommend approval of the resolution related to the proposed labor agreement with Teamsters Local 320 Service Maintenance and Labor Unit. I move its approval.
And a second? Second. Thank you. Discussion? Okay. All in favor, please say aye.
Aye.
Any opposed?
Aye.
All right. That motion carries. Thank you.
Lastly, the committee voted unanimously to recommend approval of the consent report, which includes Central Reserve's general contingency, purchase of goods and services for $1 million or more, and 1 capital budget amendment. I move approval of the consent report.
And a second? Second. And any discussion? Hearing none. All in favor of approving the consent report, please say aye. Aye. Opposed?
Aye.
Okay, we got that, Janie. Opposed? None. That motion carries. Any other business from the Finance and Ops Committee, Regent McMillan?
That concludes my report. Thank you, Chair Powell.
All right, thank you. Thank you for that report. That brings us to old business. Is there any old business to come before the board?
I have business. I don't know if it's old or new.
Well, first we'll see if there's old. Okay. Okay, no old business. New business to come before the board. Regent Hsu.
Thank you, Chair Powell. Director Steves has a copy of a resolution that I wish to buy. What's that? What?
We don't want accidents, yeah.
As this is being sent around, has it been emailed to me?
Say again, Janie?
She doesn't have it.
I understand there's
You'll
a
read it.
resolution being oh, you're going to read it? All right. I didn't know if it had been sent
Usually, Brian.
electronically to me.
So, Janie, we're going to email it to you, and it will be read.
All right. Thank you.
Okay. Everybody has a copy. Regent Hsu, you have the floor. We're in new business, and we've just seen a resolution related distributed to the board.
Yes, thank you. Now, do I read it or does Brian read it? Typically read them in the past, but.
Typically, we only read resolutions when we're closing meetings for attorney-client privilege or matters such as that. Typically, these kinds of resolutions we haven't read into the record. And if Regent Mayron is able to have it via email, then everyone would have it in front of them. So.
Okay, I can read it.
Thus far, I haven't received it. I'm just checking all the accounts I've got here. I haven't gotten it yet. I'm watching for it. So I'd suggest it be read then.
Okay, this resolution is related to the appointment of the Executive Vice President and Provost, whereas preventing sexual misconduct, protecting victims or potential victims of sexual misconduct, and holding accountable, there's a word missing, accountable perpetrators of misconduct, oh, you put it in a different place, misconduct accountable are among the most important goals and commitments of the University of Minnesota. And whereas the Regents approved the appointment of Dr. Rachel Croson, currently serving as a dean at Michigan State University, as the University of Minnesota's Executive Vice President and Provost, effective March 30th, 2020. And whereas questions have been raised publicly beginning February 14th, 2020, when an attorney representing an MSU employee and alumna spoke to the MSU trustees during a public comment session about concerns over the handling of a sexual harassment complaint against Dr. Norder, a faculty member in Dr. Croson's college. And whereas questions remain about the handling of the matter, some of which are impacted by data privacy issues from the appeals process in the MSU matter, and whereas Dr. Croson is a nationally recognized leader in the effort to prevent sexual misconduct and protect victims of sexual misconduct, and understands the importance of appropriate processes for addressing claims of sexual assault, as well as public and especially victim confidence in those processes. And whereas the Board of Regents has a duty to understand the circumstances and respond to questions about the performance of the university's senior administrative leaders both before and during their employment at the university. Now, therefore, be it resolved that the administration is directed to respond to questions and provide information to the Board of Regents in a legally appropriate way to address concerns of the Regents about the handling of the doctrine order matter. Be it further resolved that Dr. Crozen's installment as Executive Vice President and Provost is suspended until such time that the Board of Regents, at the call of the Chair and under Minnesota's open meeting law, shall meet to direct the installation of Dr. Crozen as Executive Vice President and Provost, or take such other action as the Board of Regents may determine.
Okay, so that's the motion related to that resolution. Is there a second?
Second.
Okay. So before we open this for discussion, I urge the care as we discuss this topic, just as the University of Minnesota must uphold the confidentiality of its Title IX processes and respect the rights of all parties involved, we must also maintain confidentiality and respect for those processes at other institutions. We must not discuss any details related to the ongoing Title IX matter involving a faculty member at Michigan State University, regardless of the source or how any of us as individual regents came to know of those details. So let me repeat what I just said. We must not discuss details of a pending Title IX matter. And I would just like to add that personally I have great confidence in Rachel Crozen's leadership, and I look forward to her start as our new Executive Vice President and Provost. So before we open this for discussion of the proposed resolution, I'd like to ask President Gable if she has any comments to share with the board.
Thank you, Mr. Chairman, members of the board. I've reviewed the circumstances arising from the ongoing confidential Title IX proceeding at Michigan State, and I can assure each and every one of you that during the course of the hiring process, between our communications on this issue, through my own observations, I have zero concerns about Rachel Crozen. I find no basis to disturb a University of Minnesota hiring decision that had overwhelming support, including from the search committee and this board, with written endorsement by the Dean's Council and full support from the Faculty Consultative Committee. I would also like to note for this board that this exact sort of question is a part of my research area from my time as a scholar. I've been cited by other scholars and courts and have served as a consultant in this area. These questions and the prevention of sexual misconduct are a key part of my presidency, a key initiative for the university through the President's Initiative for the Prevention of Sexual Misconduct. Rachel Crozen's expertise is as a nationally recognized leader in the prevention of sexual misconduct. This is a cornerstone of why I recommended her to you. Most recently, she was invited to serve as one of 22 members on an AAU advisory board on sexual harassment and gender discrimination. Based on her contributions to that group, she was asked to then present the group's work to the AAU President's Partners meeting in October. She has offered to this board the names of people on the Michigan State campus who do this work all day, every day as references in support of her efforts and her personal commitment. I see zero, and I am speaking in all ways, by virtue of my obligations to this university system, my expertise as an administrator, my expertise on the subject of harassment and discrimination. I see zero reason to do anything but be grateful that we have someone of this caliber joining us as a leader and as a part of our community. Everything I know about her make me want her here more than ever to help us advance all of our campus commitments, including our commitment to the prevention of sexual misconduct. I look forward to working with her and partnering with her, and I appreciate all that all of us do to ensure that the University of Minnesota's best days lie ahead. Thank you.
Okay, thank you. So we'll open it up for discussion. Regent Davenport.
Thank you, Chair. And I've got 3 points I'd like to make. First being that I am surprised and disheartened by this coming up front to us. I wonder what the real intent of it is. Second, I would urge my colleagues to quickly dismiss this and vote against this resolution. Third, I got to ask, how many around this shoehorn have been trained in sexual harassment investigation, have investigated, have been a decision maker, and has had to implement consequences? It's so complex. There's a lot of privacy in that. And I'm going to wager a bet there's only 2, and it happens to be the 2 women sitting around here who have done all that. We heard from President Gable. I've done this since 1988, and more cases than I care to count. So I would just urge us to celebrate the skills that come with the new provost and quickly dismiss this motion.
Regent Shu. Rocha. Regent Rocha, forgive me. It's spreading, Dave.
Mr. Chair, it's a very awkward circumstance. Could we get legal guidance as to whether we could close the meeting to discuss the circumstances here?
So, just members of the board, Regent Rocha was kind enough to inform me earlier that would consider recommending that we close the meeting. And I think everyone knows that we're very much committed and bound by a commitment to transparency in meetings. It's a very broad commitment, and the circumstances under which we can close it are correspondingly very narrow, having to do with litigation or personnel performance matters. And in my own conclusion based on that guidance is that we can't. And our general counsel has affirmed that belief that I have, and so I would strongly recommend that in this situation we not close the meeting. I think this is something that it's out there, it's public, we need to discuss it as a board openly.
Chair, if I can follow, here's the challenge. You know, the chairs started the conversation with an admonition that there are many things we can't talk about in an open setting, and then now we have an appeal to be open about it, and it's I think part of the challenge, and I guess the maker of the motion has not yet had a chance to speak to his motion outside of reading it into the resolution, but you know, we receive communication from general counsel in a confidential manner, and again, we're admonished not to communicate with each other about that, or there's a question about whether a responsive email or a request would be covered by that confidentiality. And so we're really, you know, to be able to have a dialogue as a board, we're very limited in our capacity to talk about things that are of a sensitive nature that I, you know, I'm concerned that we move into a new realm when, if we have members of the board calling into question the intent of other members of the board at the board, as moments ago. But you know, any guidance that we could have in being able to have a fair conversation about an issue of public concern and something that we're all committed to, without it being charged in the way that it's, I think, kind of just been set up, would be very hopeful. And but I would, before making other statement, I would ask that the maker of the motion speak to the purpose of his motion.
Regent Shu.
Thank you, Chair Powell. I felt the need to discuss this because I do not believe that we have heard adequately about the concerns that were raised. This was originally sent to me by the faculty member at MSU that made the original report in the Title IX complaint in August of 2018 against Dr. John Norder, who is a professor of anthropology in the College of Social Sciences. And that is the college where Dr. Croson is currently the dean. Dr. Croson also participated on campus interviews here, or in Minneapolis. And in her presentation, she said that, as you know, Michigan, and I'm quoting, as you know, Michigan State, or MSU, has gone through a horrible, horrible tragedy and a horrible crisis in the last really 3 years since I've been there, where hundreds of women were assaulted and nobody caught it and nobody did anything, and it was allowed to go on for years. And it's been quite a time and quite a process at MSU. And whatever you think about the legal implications and the settlements and the courts and all that, it is true that we failed to protect these women. And many of them were our students. And we failed to protect them and many children, and we failed to protect them, and that is an absolute failure of the institution. One of the things that I've seen and that I've led at MSU is changing our systems, moving to a more trauma-informed process and setting up a culture where people are more safe and more comfortable to come forward with concerns. And so I think it is an important role for the provost to set that tone, to design the systems to make sure are implemented. So I did not actually pay much attention to this. I've never met Dr. Croson. All I know is that people told me when she was being interviewed that they really respected and liked her resume, which we heard a lot of just now, that she would be bringing that to the University of Minnesota. And as you know, we have in previous work that I and other members of this board did to help create the President's initiative on sexual assault and sexual harassment. And so this is very important. It's a very important topic and should not be dismissed quickly, because we've had the opportunity to hear from students, and students are concerned, especially students who actually participated in this interview process. And when the students who participated in the interview process actually heard Dr. Croson talk about the exact case that we're talking about, unless there's more than one like this, but I think it's safe to say that this was actually used in her interview to bolster her credibility in this area. And when the email I received following that trustees meeting at Michigan State on February 14th, 2020, I became concerned, and that email was not just sent to me, it was sent to me and a reporter or editor at the Minnesota Daily, and was also sent to the student MSA president. So the other aspect of this that is troubling is that, so there's two parts to this. One is that it took so long. The reason the attorney made the appearance at the public comment session at Michigan State was because this case had been going on for 540 days, 40 some days. And it is my understanding that it was resolved where the individual was found responsible the next business day. The president of Michigan State University said that he would look into the matter, didn't understand. Let me see what he actually said here. He basically said that he didn't know the details and he would look into it. And it was basically the termination came out the next business day on Monday, February 17th. So I believe that it is our duty and our duty of care to actually look into this, yet it really hasn't been looked into, and we've had this since February 15th. I think I forwarded it to the General Counsel's office on February 15th or 16th, and we have received certain memorandums about this particular situation, and very little information. In fact, I will say that at the risk of saying too much, I will say that I'm disappointed that in those communications from the General Counsel's office, we were given inaccurate information, and I have trouble understanding why that would be the case. So let me just say that one of the things that was mentioned by the attorney representing the person who made the claim was that the Michigan State Information Security Department produced a report of findings on what was found on Dr. Norder's computer. And this came out in January of 2019, which was over a year ago. And it says, and I'm just reading from what the report says, the MSU Information Security produced a report of its findings. Recovery of over 1,000 sexually explicit videos and image files, some of which included the subject himself. Evidence of file deletion, including the sexually explicit images. And web browser bookmarks for at least 6 sexually explicit or hookup websites. This is off his office computer. So I think that we, as a board, deserve some more information. We deserve information that has not been provided to us in the 30 days, nearly 30 days since this has been brought to our attention. And I guess in closing, I'll say that one of the things in the email that we received was that at MSU, this is in reference to Dr. Croson, at MSU, she is not viewed by victims as a person who promoted the right choices after the Nassar scandal in the strategic plan that Michigan State as a school dealt with fallout from the sexual abuse scandal involving former physician Larry Nassar. Croson is currently making choices in an active sexual abuse scandal by allowing John Norder to teach that many feel needlessly endanger students. There were also links to media stories attached to the emails, and then other media if you went out and looked for it. So all I'm asking for is some time and actual information so that we can actually make a correct determination on this new information that has been provided since the interviews. Thank you.
President Gable, you'd like to comment?
Thank you, Mr. Chair. I want to make a point of clarification. There was a quote read from Dean Croson referring to the Nassar scandal, not the issue at hand. And those are very, very different cases. Thank you.
Others? Regent Rocha.
Thank you, Mr. Chair. I'll be brief. I think it's important that, particularly in cases like this, when you talk about whether somebody was popular or unpopular in their selection or in their role, I think we always have the same standard. I don't know that answers the question, but I take a bit of a different take than my colleague Regent Hsu on this, in that, when I received the information, as we did as a board, I was, concerned, disappointed that anything was even being raised, much as I think the president's disappointed that it's a question. But I read the articles that were open source to try to have at least an understanding of what the public dialogue was in east of here. And as a matter of simple due diligence, having observed what's happened at other institutions where it's not only the underlying action, but how the institution handles a matter, I just asked some what I felt were fairly simple questions. Just saying, I just want to understand this, so if I'm ever asked about it, I can say, yes, I asked, and I've reached a level of confidence that there was nothing to be concerned about from the University of Minnesota's perspective. But ultimately, the response that we received, or that I received, was limited, and I was finally just simply told that I would be receiving no more clarification to what I think were fairly straightforward and reasonable questions. And that's certainly not, I don't believe that's Dr. Crozen's doing by any measure, but it's a concern about how we as an organization get access to this, because I'm sure every institution that's dealt with a major crisis where you have administrators and even trustees leaving because of the nature of the challenge, somebody wished they would have asked the questions. And so, but in the process of receiving responses, we received some information that was not accurate, and which has then been clarified as that it was not accurate, and I simply was seeking the basis for how we receive that information to make sure that I understand what exactly is happening. And I've been often and told that I would not receive that information. And so I do think that we have a continuing conversation about how we engage these types of very delicate issues, because an institution of this size, we're going to run into them from time to time. And as I've stated, I'm committed to doing due diligence when these kinds of things come out. Every victim and every accused, I think, would want the board to be committed to that. That being said, what's so awkward about this is that I want to ensure that our senior administrative leaders have the best opportunity to succeed. I think this is an unfortunate fact that rather than getting the answers in a way that we wouldn't be sitting here, and I think I do share some of Regent Shu's concerns about the information he's been provided or the lack of information. Someone's involved, someone that's going to soon be part of our team, but there are also people involved in the underlying matter as well. I believe that the record has been made by virtue of the conversation. I do plan to seek clarification on these questions, and I do plan to continue to ask the question about what our right is as members of the board to have information of this variety. But I don't, at this point, have a basis to say that we should delay the installation. And so, to that portion of the resolution, I will not be supporting the resolution. I would actually ask that the maker and the seconder consider withdrawing it, having made the case for the challenge, so that we can move forward and essentially have the ability to understand this issue as it continues forward. I know that there's going to be a report that will likely be public at some point that will give us a better understanding of whether there's more of a conversation for this board to have. But that'd be my request of the maker and the seconder.
Hearing the request, is there a reaction?
Well, as the maker, I would just say that if we can agree as a board that we're actually going to look into this as opposed to what we've done over the last 30 days, I would withdraw if I can get a commitment that get the information that we're looking for.
Well, as a Title IX, protected inquiry, I don't think we're in any position to make that.
Well, Mr. Chair.
This is a Title IX protected process. Full stop.
I don't know what that means.
It means it's protected.
Well, there are parts of it that are protected. I think there are other parts that have been, where questions can be answered. So if we could get our general counsel up here to answer some questions, maybe that would.
So the motion stands, or?
Well, for now, if you're unwilling to.
I don't think we're in a commitment to, there's a confidential Title IX process that has a broad respect for the rights of all parties involved. And I just don't think we're in any position to respond to this most recent request.
Well, unfortunately, what you're suggesting is that we, as a board of an institution, another institution, cannot have any more information about the person that we've hired to be our provost. I think that's a problem, and maybe that's a higher ed problem in general. But I think that we, as the hiring authority, should be able to get clarification about the handling of this matter. For example, one of the issues is the fact that this person was allowed to continue teaching undergraduates, teaching two semesters or two classes or two times a week on campus. And I understand that Michigan State's policy suggests that there are several people involved in making the decision, but I would like to at least hear what Dr. Crozen's input was into that process, and I don't know why that can't be provided, but maybe.
Thank you, Regent Hsu. Regent Davenport.
Thank you, Chair Powell. You made my point about Title IX protections, and even based on what was just read here, that's not the whole story. That's just a piece. And so.
Regent Beeson. Thank you, Regent Davenport.
Thank you, Mr. Chair. I'm really troubled by a lot of this, a lot of your comments, Regent Hsu, and resolution. And what I'm maybe the most angry about at the moment is this association with Dr. Nasser. I really think that you were escalating and associating his behavior with Dr. Croson by virtue only of the fact that she works at the same university. She's been, I'll finish and I'll let you respond if you wish.
Yeah.
For the record, and you've actually stated she's an expert in this area. There hasn't been any evidence of wrongdoing by anybody in a position of authority around her role in that situation or in the rest of everything else that's gone on at that university. So it feels like a smear to me. I'll say that.
Well, I didn't create the situation, and I certainly didn't create the email that came to me. I would say that the Nasser comment was actually brought up by Dr. Croson in her interview process. And we thought we were getting, I just want to make sure we're getting what we thought we were getting. Everybody was enamored with that responsibility and that experience from her part, on her part. And I don't think I'm smearing anybody. I think all I'm doing is asking the question as to, unfortunately, she's coming from the university that had this problem, but she's also used that to bolster her credibility and her experience as a candidate for the position. So, I don't think it's too much to ask to get that information about this particular case.
Regent McMillan.
Thank you, Chair Powell. I don't support the resolution, and I'll leave it at that. I know my concerns go to the fact that I've heard Regent Hsu suggest that if we could get something done, let me see if I can paraphrase this correctly, in the next month as opposed to what's happened already. And I want to speak to that in that I have gotten a lot of additional information. And I know there's a fact in dispute in the middle of all that we may or may not be able to get to the bottom of, but I just want to be sure it's clear that I appreciate what the President has delivered, what the General Counsel has delivered, and I appreciate your role, and you were one of the early people contacted about it. So I just don't want to cast any aspersions on the work that's been done to date, because to me it significantly informed me, not fully, I don't think we can get to full information under a Title IX process right now, but it's not like nothing's happened or there's been any effort to conceal facts. I can't go there and I won't endorse that. I don't feel that way about it. Would I like more information? Always like more information, but based on what our president just said and what we have learned, I'm ready to move forward.
Thank you, Regent McMillan. Regent Kenyatta.
Thank you, Mr. Chair. I want to, I guess, just highlight something that Regent Davenport said earlier, and that was her point about who at this table has the expertise on that subject. It's certainly not me, and I think it was highlighted by my colleague Regent Hsu when the chair said it's a Title IX matter, and you responded, I don't know what that means. And I think that highlights our lack of knowledge and expertise on the complex nature of these things. My question or comment or suggestion is Regent Hsu appeared somewhat willing to withdraw if there was a commitment. Can we commit to asking, what Regent Hsu wants to know and what other regents want to know, and then Michigan, in their judgment, in line with their laws, can respond or not respond if they feel they can't. But I mean, we can't control the response. And then with that commitment, would Regent Hsu be willing to withdraw?
And I would like to speak at some point. This is Janie Mayron,
Okay.
Regent Mayron.
All right. Thank you, Regent Kenyatta. Let's come back to that. I've got that. Regent Mayron, please.
This is in line with what Regent Kenyatta was saying. And I'm looking at the resolution that Regent Hsu has put forward, and it's the first piece after the whereases where it says, now therefore be it resolved that the administration is directed to respond to questions and provide information to the Board of Regents in a legally appropriate way to address concerns of the regents about the handling of the Dr. Norder matter. I think that is exactly what the administration has done in terms of responding to issues and questions. Granted, it has come to us in by and large, in an attorney-client privilege communication, which I think is the legally appropriate way to address those concerns of the regents. And so I think, in fact, that due diligence has been done by the administration. And based on the information that's been provided to me, I am more than satisfied with the qualifications of Dr. Croson to join us as a second in command here at the university. So for that reason, I am, at least as the resolution is now worded, I am going to vote against it.
Okay, and I think Regent Mayron, in effect, answered your question, Regent Kenyatta, that she's satisfied there's been diligence. We've pursued answers with Michigan State. I think they've given us what they are, willing to give us, and they're obviously, for good reasons, very protective of their Title IX process. Regent Simonson.
Chair Powell, I think Dr. Croson's well qualified. I'm going into it like that. But we've heard in other conversations today where action was required that there were still a lot of questions about clarity. And so it wasn't a question of whether or not we should approve this, but clarity. So we can go into this thing as with a lot of saying, yeah, we're really behind it. And so, on this question, there were questions, as Regent Hsu said, by students in the search committee. That's what I heard. There were questions by others at MSU. And there's questions here. And so for clarity, I don't know why we can't get more clarity on these issues, even the one we voted on earlier. That's my point. I think to me, she is qualified, but she's got these questions out here. Are we doing our job?
All right, thank you, Regent Simonson. Okay, one last one.
Thank you, Mr. Chair. I would be concerned that we as a board
reach a point where if I personally am satisfied with the amount of information that I have at my disposal, that's where we shut it down, and the rest of the board, particularly those who may have additional questions, are just out of luck. I think that there's more to that as a team that we should be wanting to really help the rest of the board reach a level within reason of comfort. In this particular case, and when you talk about having expertise in this area, there are actually multiple areas involved, to include administrative processes and so on and so forth. I've certainly observed my share of very similar matters in a military context through my position there, but certainly wouldn't put myself any place in the same category as Dr. Croson or others at this table. But the concept of Title IX, there are parts of Title IX that are public. We know certain things, such as there's a Title IX process going on, when it started, and so on. And then in this case, we have some things that became public through other means. But the parties in interest that the protections are particularly directed toward are the accused and the victim or victims, or the accused. If that's a different protection than I think some of the questions that have been asked. That's the point. And, again, I would disagree with my colleague, Regent Mayron. I know she may feel comfortable. There are some questions that I still have that, it's not that I think something inappropriate happened. It's that I don't know that I don't have enough to be able to rule out a concern that I might have. And I wanted to reach that point. And I have not been satisfied with the answers that I've received, and I have not been satisfied that Title IX is the basis for me not being able to receive those answers. You may disagree with me, that's fine. But I'm not seeking to cast aspersions on anybody. I'm just trying to do my job as a member of this board. Because again, whenever something goes on that ultimately leads to something substantial, it always starts in that moment where people, we're not either asking questions or not provided that information. I think Dr. Croson is going to be a great asset to the university. I do intend to continue to pursue appropriate information to reach that level for myself. And I would just again ask, based on what feels like the spirit of the board, I would ask the maker and seconder to either withdraw the motion in total or at least remove the second whereas. Second, be it further resolved. But I would recommend just withdrawing the full resolution, and we can revisit it in a timely way.
Regent Hsu.
Thank you, Chair Powell. I'm sorry, I misunderstood what you said about something from this.
Mr. Chair, I shouldn't have said it. I should have just kept it straightforward. That I think my sense is.
I think the request was that you withdraw the motion.
Yeah, that's my request.
Well, I really don't see why we would resolve it right now. We've had the discussion. I think we should take action. I would request a roll call vote on this, and we can be on the record about where we think we are on this matter, given the information that we have.
Okay, on that note, I'm going to call a vote. It will be a roll call, Mr. Steves. And the vote is, are you in support of the Regent Hsu's resolution related to the appointment of the executive vice president and provost? Is everyone clear? Are you in support of his resolution? And here's the roll call.
Regent Anderson?
No.
Regent Anderson votes no. Regent Beeson?
No.
Regent Beeson votes no. Regent Davenport?
No.
Regent Davenport votes no. Regent Herr is absent. Regent Hsu?
Yes.
Regent Hsu votes yes. Regent Kenyanya? Regent Kenyanya votes no. Regent Mayron?
No.
Regent Mayron votes no. Regent McMillan?
No.
Regent McMillan votes no. Regent Rocha?
No.
Regent Rocha votes no. Regent Simonson? Regent Simonson votes yes. Regent Swigum?
No.
Regent Swigum votes no. Regent Powell?
No.
Regent Powell votes no.
Okay. The motion does not pass. There are 9 votes against, 2 in favor. All right. We will move on to, we've gone through old business, new business.
Mr. Chair?
Yes.
Additional item of new business.
Yes.
To engage the conversation, I move to authorize the administration, President Gable's office, to utilize up to $5 million from Central Reserve to respond to the current pandemic.
Second.
Everyone understands the motion. Moved and seconded to utilize up to $5 million from central reserves to address issues and needs arising from the coronavirus pandemic.
Speak to it?
Yes, please.
Thank you, Mr. Chair. So there's this is solely introduced as an asset or an opportunity for President Gable if she so chooses. It's not a direction to use the $5 million, but she would have the authorization. It prevents us for if in the near future there is an occasion to seek funds, we don't have to rely on either emergency proceedings, which would I disfavor. I prefer the board to act in concert in that it would to the extent that there are contracts within that dollar limit, I think the emergency proceeding may be necessary unless we were able to provide a phone meeting. But I do know that in conversations with legislative representatives that there's an interest in the university continuing to play this role, and that there may be needs for that kind of support. And the legislature is putting forward a bill. It's not in its final form yet, but that would provide either loans or a reimbursement to institutions like the university if such money was needed. And this is simply a matter of giving some flexibility to the president to address some of these concerns that are being raised. And we've had, as we heard in our presentation at our retreat, that there's a potential $5 million need for resources that would be responsive to the public's, to serving the public as we go through this process. That's the intent. It's not intended to impose anything, but simply to provide a resource available to the president if she determines in her judgment that it's necessary.
Regent Beeson.
Thank you, Mr. Chair. I'll probably vote again. I understand the intent. We do have provisions for emergency meetings, and rather than having an open checkbook, I would prefer to be available on a moment's notice from the President's office to make an appropriation, and there may very well be one. And I think we all understand that, but to do this without having had a conversation about it today, and maybe I don't know whether the administration's heard this resolution before now, but I would request the author to withdraw it but with the idea that we may have to reconvene sometime between now and May.
Thank you, Regent Beeson. Regent McMillan.
Thank you, Chair Powell. I fully appreciate and applaud the intent, and I think the direction and signal of support that this provides the administration, Regent Rocha, so I appreciate it. I guess my hesitancy probably is closer linked to Regent Beeson's, and that is I don't know whether we're going to need 500,000, 5 million, or 50 million, and I would think it might be more prudent for us to react with more information before we put a marker out there. So that's it. It isn't at all with respect to spirit or intent. I like that and applaud it, but I feel like we might be groping a little bit here in the blind as to what this is going to, we're going to have just the, lack of revenue for tournament games is going to put a hole in the budget, and that to me feels like a central reserves type solution. I think you offered your thoughts in terms of money available to take proactive steps. I guess I'd, ask the administration to be thoughtful as Regent Beeson did and communicative, and if they need to pull us together to authorize something, to do it that way. But again, no conflict with the intent and spirit of where you're going.
Regent Simonson.
Thank you, Chair Paul. I'm very supportive of this. As we heard earlier today from Dr. Osterholm, this is a daily thing. And I've got confidence in President Gable that she would use that money in a responsible way, that you'd have it available to her, and we wouldn't have to get together and vote tomorrow or next week, and then the following week on another one, and another week then. So I think she would handle it very responsibly. So I'm in favor.
Yes, Regent Anderson.
It's the first I heard of this, and I think it's a terrific tool. I think it's a terrific tool. If you know, I do my little calculating, it's a little over 0.1% of the budget. It's not a whole lot of money, and we probably have that in central reserves right now. I think if we don't trust our chief executive with $5 million, maybe she shouldn't be our chief executive. So I would very much be in favor of having the ammunition to do whatever she has to do. Thank you.
Any other?
I'd like to comment if I could.
Yeah, Janie.
Comment. All right. This is Regent Mayron. This is a situation where both sides are making annoyingly good points. And I applaud you both, all sides on this. I would be curious to hear from President Gable as to what your preference would be on this. You are obviously a very collaborative person. We know that. We know you check in with all sorts of constituencies. We also know that from time to time emergency decisions need to be made, and we don't wish to hamstring you. So I would be interested in hearing from you about this particular resolution in light of what's going on.
And if I can, thank you, Regent Mayron, and maybe if I could just add to your question, because I don't understand what flexibility and freedom you would have under sort of existing statutes and controls to tap into central reserves to respond to this sort of situation. And so maybe you could, if you can add clarity on Regent Mayron's question.
Thank you, Mr. Chairman. Actually, I'd like to call up Senior Vice President Burnett, who can speak to operationally what we can do now, and then we can talk about preferences perhaps after that. And Julie Tonneson, who's wondering why she stayed at this point.
Could have been on 35W South.
That's right.
Thank you, Mr. Chairman, President Gable, members. We have a number of ways we can respond and are working on responding now with reserves that departments have, reserves that colleges have, reserves that the central administration has. It's really hard to get our arms around what this is going to cost. We were just asked that question within the last 2 hours from the state government. And we're going to experience likely both revenue losses and increased costs across the board. And what I would say is we have to report Central Reserve spending in excess of $250,000 is board policy. We need to bring that forward. That's current policy. For approval, anything above 250 we need to bring for you. So Regent Rocha's motion would give us something that is not right now standard policy and would give us some more, but we'd still have to bring it back and report to you. I envision us bringing you back some one-time things that we're going to be asking, and $5 million might just be the start. So we are challenged by being asked today to estimate this cost to the university system, and this board, we told President Gable earlier, we're working on a response to the state that we think this could be anywhere from 20 to 50 million, depending on when the coast is clear. And that's the best Julie and I can do in the last 72 hours trying to figure out what this might cost us.
Well, let me ask you this. Thank you for that. It's very helpful clarification. And I understand that you're going to report, regardless of what gets spent, we'll see a full and detailed report.
Yes, sir.
Would it be helpful to you as recognizing all the unknowns, would it be helpful to you to have some authority from the board now up to an amount? Would that help?
Thank you, Mr. Chairman. And given that I haven't had a chance to talk with President Gable, any additional tool that the board gives us in the short run, I can't see that it wouldn't be helpful to us, even though it is quite unusual for us. But we are in unusual times right now.
Okay. Thank you. Any regions have questions for Representative Reed McMillan?
Not a question for administration, but with that, hearing from administration that this would be helpful, I can likely support it. My response is, though, to Regent Anderson, I wasn't hesitant in any way about authorizing this because of mistrust or I don't know how they'll spend it. It was purely governance procedure was my reaction. I have full faith and confidence that they will spend money with or without our authorization appropriately and follow policy and procedure.
Right, and Regent Beeson.
Thank you, Mr. Chair. We did get a review last session on the on balances and the balances that are held, for example, in the medical school or the other schools that are going to be impacted. Those are, we talked about that. They are available for emergencies, and they're available for, and they get driven by the people who have to deal with the issues that are going to be driven by the outbreak. So I don't know that we need it. We've got balances, we've got reserves, we've got availability if we need to replenish those from the Central Reserve, along with money to make up for revenue losses. If we don't get tuition in, or we've got whatever. I'm glad we're talking about. There will be a financial amendment. There's going to need to be, but I prefer to do it as something more comprehensively.
Thank you, Regent Beeson. I see that General Counsel Peterson has joined the other folks at the podium. I'm assuming that you would like to say something to us.
If that's appropriate, Paul. I wanted to offer a procedural suggestion, maybe an option to reconcile what I think are two really good points of view here, and maybe to touch on the governance issue that lurks, because this may not be the only emergency facing the University of Minnesota over the course of time. So it seems to me that picking up on Regent Rocha's notion, there could be a resolution to extend emergency authority to administration up to this $5 million number, notwithstanding what other policies may require, but make it subject to later ratification from the Board of Regents, so that at some point the administration needs to come back to you, presumably in the meeting, so that you'll formally ratify it, keep those expenditures within your purview, so to speak, but clearly signal here that President Gable and the administration have running room to tackle the problem at hand. There are a number of concessions that undoubtedly we're going to need to make every day of the week here as this unfolds. So I really respect Regent Rocha's suggestion, and maybe that ratification tool device to just honor the fact that the board needs to keep control of the budget.
So if just to kind of capture that amendment, the resolution would be something along the lines of: the board authorizes President Gable to draw up to $5 million from central reserves to fund initiatives related to responding to the coronavirus, subject to later ratification from the Board of Regents.
Accepted.
Any other? So there's been sort of an accepted amendment. Do we need a second? Second. Any other? Regent McMillan.
Yeah, that works for me. I can support that. I think it might be even better if we just said to exceed the current limitation of 250. You're authorized as long as you come back with the resolution. But what I just don't want to get into is if they need 4.2 million now and then 1.6 later, that we've got a procedural hang up. But I can support that, but you could write that just to say the 250 is suspended, pending follow-up with us, that you can exceed that for purposes of this. But I'm not trying to wordsmith or make it better. I just don't want 3 bites at the apple here at the board with the follow-up and all that comes with that. But I can support it.
I think we are going to have multiple bites at this.
Probably.
I mean, this I think is my view is that this is just the opening. I don't know where it's going to go, but it gives us some flexibility now. I mean, I'm talking too much. So everyone is tracking with the motion as it stands. It's been moved and seconded. All those in favor of this motion, please say aye. Aye. Any opposed?
Aye.
The motion carries, it sounds like, unanimously. Thank you. Okay. Before we adjourn, I just I know Joan has maybe some updates on what the state's doing, Governor Walz, and maybe, Joan, if you could just briefly comment before we adjourn. And this is, again, related to the coronavirus.
Yes, thank you, Mr. Chair. While we were meeting, the governors declared what's called a peaceful emergency with a set of recommendations from the Department of Health. I'm going to read you the list of recommendations. Event organizers canceling or postponing gatherings with 250 or more people, and then gives examples. Event organizers canceling or postponing smaller events, i.e. those with less than 250 people, that are held in settings that do not allow social distancing of 6 feet per person. Event organizers limiting attendance to no more than 10 people for events where the majority of participants are at higher risk for severe illness from COVID-19. People and families at higher risk of severe COVID-19 illness staying at home and avoid gatherings or situations with potential exposures, including travel. Employers making telework arrangements for workers whose duties can be done remotely. Employers staggering work schedules and limiting non-essential work travel. Healthcare facilities and assisted living facilities more strictly limiting visitors. Faith-based organizations offering video or audio events, hospitals and other healthcare facilities implementing triage before entering facilities, for example, parking lot triage, phone triage, and then there's some follow-up details. Obviously, most of these affect us in one way or another. We will work with our emergency management protocol as we have been all along, and you'll see a report from me with resulting escalation in our plans coming out soon. But I wanted to make you aware of this.
Okay, any questions for President Gable on that update? All right, I would entertain a motion to adjourn. Second, all in favor, say aye. Opposed?
Aye.
We're adjourned.
Signing off. Bye-bye. Travel safe.